Hi, my name's Hannah Hylton. I'm a specialist physiotherapist at St Bart's Hospital in London. I work with the difficult asthma team and I specialise in disordered breathing and working with patients with breathing pattern problems, particularly within asthma. We often use Buteyko techniques here. They help us to support patients managing symptoms around difficult asthma and also to improve breathing patterns where we've identified breathing pattern disorder. Holly is here today to help us as we try and demonstrate a couple of techniques to you. So we're going to show you the Stop Cough technique, which is a technique we use a lot around asthmatic and COPD patients who have that dry, tickly cough, working to break that cough habit. And we are also going to show you the reduced breathing technique, which is a component of the breathing pattern retraining that we may use within Buteyko. So we'll start with the Stop Cough technique. Now, Holly, you were telling me that you've got a tickly cough.
Yeah, so I have this cough that's quite persistent, it's quite dry, and I often feel like I have that sensation where I need to clear my throat quite frequently.
Okay. Are you coughing anything up with that?
No, it's quite dry. I haven't noticed that I've had to cough anything up at all.
Brilliant, okay. So this is a technique that's great for that dry cough, but we wouldn't use it if you were clearing any sputum.
Sure, okay.
So with this technique, we're particularly working to reduce airflow and reduce that irritation that comes from the dry tickly cough that makes us want to have that cycle of coughing. So we're trying to literally stop the cough.
Sure.
Okay, so it's quite easy to remember. We're going to talk about it as the 4 S's.
Okay.
Now, this is something you can practice when things feel good, so you're familiar with how to do it, but I particularly want you to use it the moment you feel that urge to cough or that tickle cropping up.
Okay.
All right. Now with Holly, we've assessed her. We know there's nothing else going on behind this cough. We're quite satisfied that we can move forward with teaching this technique. So the first S is smother. So as soon as you feel that urge, I want you to smother your mouth with your hand.
Okay.
Good. So keep your hand there. I want you to keep your hand there for 30 seconds whilst you add in these other techniques. It might feel like a while, but we need that. Good. So the second one is swallow. So I just want you to add in a dry swallow from your saliva. Good. Just reducing that irritation. And the third thing here is slow nose breathing. So just focusing on getting your breathing regular and rhythmical through your nose. So you're avoiding the urge to take bigger breaths at this point. And actually you might feel like you have quite a strong desire to take a big breath. We call that air hunger. And it's fine, it's safe, it's just a feeling that comes when we're trying to reduce our breathing. Good. So that's been about 30 seconds. If you just take your hand away now, keep your lips together, and the 4th S is smooth. So I want you to go straight back into smooth breathing through your nose. If that tickle crops up again, you can go back to the beginning for another 30 seconds, but otherwise you keep going with that smooth nose breathing. How does that feel?
Yeah, I mean, it's quite difficult to do to begin with because you definitely have that sensation where you have that urge to take in a really big deep breath. But I did feel it quite relaxing and it almost draws away your attention from that desire to clear your throat or cough because you're focusing on the other stages.
Absolutely,
yeah. So just so I've made sure that I've got it.
Yeah.
The 4 S's. Number 1, smother with your hand over your mouth. Then the swallow, then we need to make sure that I do the nice slow breathing in and out through the nose. And that's for 30 seconds. Yep. And then remove my hand and just continue with the smooth, sort of like rhythmical breathing, equal breaths in and out.
Perfect.
Fine.
Thank you, Holly.
I think I've got it.
Excellent. So that's the Stop Cough technique. Please feel free to ask any questions. So now we're going to demonstrate the reduced breathing technique, and Holly's going to help us with that one again. So to start with, it's really helpful if we can just look at our own breathing and understand how we're breathing ourselves. So if you want to join in with this, that's absolutely fine. Holly, I'm just going to talk you through how to assess your own breathing. So sitting comfortably in a chair, leaning up against the back, making sure your feet are on the floor, firmly planted. If you need to, even get something under your feet if they don't reach the floor. Pop one hand on your tummy for me and one on your chest. Good. Maybe have the tummy one just a little bit higher. Good, just at the top of your tummy, just below your ribs. Okay. Excellent. And relax your elbows down by the side. Good, just so your shoulders are relaxed too. Brilliant. Feel comfortable?
Yeah.
Good. So just as you're sitting there breathing, I want you to think about where you're feeling the movement. Now I can see a bit of movement in your chest.
Yeah, I can feel a little bit in my chest and a little bit in my belly.
Yeah, okay. What I want you to try and do is start to relax the chest and focus on the breathing in the tummy. We want a little bit more movement down in the tummy and we want less up here, okay? At the same time, I want you to keep going nose breathing. If you feel like you need to clear your nose at any point with this, that's absolutely fine. You need a clear nose to do this properly. Good. Once you feel like you've managed to relax that chest as much as possible, it's fine to have a little bit of movement. Just relax your hands down onto your lap. Place them down here for me. Good. We're going to do reduced breathing. Now, some people find it helpful to close their eyes during this. You can feel free to do that or not. That's absolutely fine. But what I want you to do is to start to focus on the breath in, gently coming in, gently breathing out, and then a pause. And keep going with that in and out breathing. And I want you to gradually try to increase that pause to 1 second. Excellent. Now we've talked before about the air hunger, and you may feel that air hunger creeping back as you do this. So you may feel like you have a sensation that you want to take a bigger breath. Just try to resist that. Try to keep it calm and relaxed. Really, really good. Excellent. And relax. How did that feel, Holly?
Yeah, it's quite difficult actually to begin with. You do feel that urge, I felt the urge quite early on to want to take in that deep breath. But actually it is very relaxing. I guess it's just something that I'll have to do quite frequently to get better.
Okay. It does feel more comfortable with more practice. That air hunger improves and gets less. Really good. Thank you. So please feel free to ask any questions on the reduced breathing technique as well.